My name is Smita Bajpai. I am a traditional medicine doctor, doctor of Ayurvedic medicine and surgery. I am with Chetna since past 28 years. I am a project director. I direct programs related to maternal and child health and nutrition and also women's nutrition. I also coordinate the activities of White Ribbon Alliance Rajasthan, and I am also involved in the National White Ribbon Alliance because Chetna is a former co-chair of White Ribbon Alliance India, and we are a member of the White Ribbon Alliance India. We started the alliance with almost 100 listed members. These are organizations, individuals, development partners, and government of Rajasthan representatives. So we had a whole mix of people who are members of White Ribbon Alliance. We continued our work all through these years with so many partners. Since 2013, we thought we should narrow down, and at present we have 18 listed members. With these 18 partners, we are working in 14 districts of Rajasthan and also at the state level. When you ask about activities of White Ribbon Alliance Rajasthan, it's a range of activities. Our main aim is awareness, action, and advocacy. Rajasthan is among the high focus states of the National Health Mission with a high maternal and neonatal mortality. There are several key challenges in the state of Rajasthan. I think one of the main challenges of Rajasthan is human resource. There is not enough human resource in the public sector to provide services to all. The second challenge is the geographical diversity. Almost 13 districts are semi-arid or arid region. There is a hilly region and there is a plain region. So to plan and cater to needs of this diverse geographical areas is a challenge. The third challenge is the feudalistic society and control over women. It is still, everybody knows Rajasthan is a land of kings and kingdoms. The feudalistic nature of society still is there. So to collect people, gather people for an agenda is a challenge. Status of women is also another challenge. Women are really controlled. They have low mobility, they have low literacy, they are powerful, but there are controls. For example, we had this initiative in Rajasthan, in Jodhpur, where women were not allowed even to spend more time at the health facility, and they were asked, just jao, tikakaran lo, vapas aa jao. So we had to work a lot on the culture of silence, raising the voice of women, articulating their needs by women and giving space to women so that they can share their experiences. So that is a major challenge that we have in Rajasthan. Besides that, there are other challenges such as neighboring states. So there is a lot of migration, in-migration and out-migration, temporary and seasonal. So there are a lot of migration issues. So people migrate, particularly if you look at the border districts, almost 60% of houses are closed. So how do we reach out to those women? Again, men migrate. Women are often left alone in their houses. So how do you cater to the needs of women when there is no one around and decision is taken by men who are quite far off? So these are some of the challenges that we see when we work in Rajasthan. I totally agree with this view. Civil society organizations have a critical role to play in strengthening of women's voices and amplifying their voices at various levels. Firstly, because civil society organizations, and I would add alliances also, are rooted in the social context where women live. They have a greater understanding of the social realities of women. They have the zeal and the passion to work with communities and empower them. So they are, I would say, they are a pillar in strengthening women's agency to fend for their rights. The White Ribbon Alliance Rajasthan has done this. We have talked to women, listened to their experiences of accessing maternal health services, and taken their voices at the state level, at the national level, and at the global level in the form of citizens report card at the Global Maternal Health Council, which was held in 2010. When we started our work in Rajasthan, we tried to look at NGOs who are working on maternal health, and there were very few NGOs who were working on maternal health and very few on advocacy. So we identified NGOs who were working with women at the community level, working on women's empowerment, microfinance, and engaged them on the issue of maternal health. Now, when we engaged them, they were very passionate about the issue, but there were issues of capacity. Some of the gaps were their technical understanding of maternal health, their technical understanding of advocacy as such, and also some of the organizational issues such as managing finance, having their own balances and checks, having processes which would retain human resource, and their communication skills. Communication skills to the communities were all right, but then communicating about their work to outside world was a major challenge. This capacity building support has really helped the partners, the NGOs, the civil society organizations of the White Ribbon Alliance Rajasthan to reflect on their organizational procedures. At the end of this training, we will prepare an action plan to identify and address some of the gaps at the organizational level. The first step in this direction would be have a team discussion at the organizational level so that various improvements in the areas of human resource, recruitment, retention, managing of human resource will be taken up. A great initiative of this effort or partnership is the strengthening of finance aspects, the due diligence discussion. I think that will help organizations to plan for due diligence and strengthen their internal mechanisms, their internal checks and balances to have a system which is more robust and more accountable. This capacity building support by HFG was very valuable and very positive experience. I value the most was its inclusiveness and a participatory approach. There was a series of meetings with partners, with the Secretariat Chetna to plan and discuss the capacity building initiative. It was not based entirely on assumptions. There was a needs assessment done. There was an assessment of various mechanisms and processes at the NGO organizations. We had a meeting with partners to discuss what should be the focus of the capacity building training, and there was a hand-holding support based on the needs expressed by NGOs. So I think this whole process of building capacities was very enriching, very participatory and grounded on the needs of the organizations, and I value it the most.